So Dr. Vartika Yadav is here and she is presenting presentation on posterior vitreous detachment in myopia, and this is a cross-sectional study.
Good morning everyone present here. Good morning judges. I am presenting my paper on the topic Understanding Posterior Vitreous Detachment, and I am Dr. Vartika Yadav from Rohilkhand Medical College and Hospital Bareilly, and I am giving my paper on the topic Understanding Posterior Vitreous Detachment and Degenerative Changes in Myopic Eyes. Starting with my paper, posterior vitreous detachment occurs when the vitreous humor separates from the retina. This condition is more prevalent in myopic eyes due to the structural changes in the vitreous body. The vitreous humor, which normally maintains contact with the retina, becomes liquefied and collapses over time. As myopia progresses, the elongated shape of the eye places mechanical stress on the vitreous, leading to its detachment from the retina. Myopia and its impact on the vitreoretinal interface. Myopia, especially high myopia, is associated with axial elongation, which causes a stretching of the retina and vitreous. This elongation leads to earlier onset of vitreous liquefaction, vitreoretinal interface changes, and increased risk of PVD. In high myopia, degenerative changes such as lattice degeneration, macular holes, and retinal tears are common complications. PVD can lead to retinal tears or detachment in these eyes, which can result in severe vision loss if not detected early. Risk factors and pathophysiology of PVD in myopia. Axial lengthening and aging are significant risk factors for PVD in myopic patients. Increased axial length stretches the vitreous body, creating mechanical stress leading to earlier detachment. Age-related vitreous degeneration occurs more rapidly in myopic eyes, with patients often experiencing PVD earlier than emetropic eyes. The risk of complications, including retinal detachment, is higher in myopic eyes, making earlier ophthalmic evaluation essential. Epidemiology and clinical importance of PVD in myopia. The prevalence of PVD increases with age and axial length. In the general population, PVD often occurs in patients over 50, but in high myopia, PVD can occur as early as in the 30s or 40s. Patients with axial lengths over 26 mm are particularly at risk. Clinical detection of early PVD is crucial, as untreated PVD can lead to complications such as retinal tears, vitreomacular traction, or retinal detachment. The aim of my study was to study prevalence, clinical profile, and association of different grades of posterior vitreous detachment in myopia. Objectives: to determine prevalence of posterior vitreous detachment in myopia in different age groups, to analyze degenerative vitreoretinal changes in patients of myopia, to examine the association of choroidal neovascular membrane in myopia, to study occurrence of retinal breaks and retinal detachment. Inclusion criteria: patients above 20 years of age with complaint of painless diminution of distant vision with myopia, patients with axial length more than 24 mm, and patients giving informed consent. Exclusion criteria: patients with curvatural lenticular or index myopia, patients with hereditary vitreoretinal dystrophies, patients with vitreoretinal disease, patients who had undergone vitrectomy, and patients who had history of blunt trauma. Materials and method. This study was done on a sample of 164 patients who had come to the ophthalmology OPD above 20 years of age, satisfying both inclusion and exclusion criteria. A detailed history was taken, giving due emphasis to the complaints, onset, duration, and history of wearing spectacles, and family history for suspected refractive errors. A preliminary examination.
About this is not working.
Okay. A preliminary examination of uncorrected and best corrected visual acuity for distance was conducted. Refraction was conducted meticulously to evaluate the true refractive status of each eye. Slit lamp examination was performed to evaluate the anterior segment of the eye. Keratometry was conducted to measure the curvature of the cornea. Intraocular pressure was measured to monitor any changes in eye pressure. A-scan biometry was performed to assess the axial length of the eye. Fundus examination and imaging were done to observe the posterior segment of the eye. B-scan ultrasonography was utilized to evaluate the posterior vitreous in retina. OCT was used to provide detailed imaging of the retinal layers. Patients were divided into two groups based on their myopic refractive error after the pinhole test. Patient A, patients with a myopic refractive error between 0 to 6 diopters, and group B, patients with a myopic refractive error greater than 6 diopters. Results. Prevalence of PVD. Overall PVD prevalence was 38%. In high myopia, it was around 51%. In moderate myopia, it was around 35%. In mild myopia, it was around 20%. Degenerative changes in retina. Lattice degeneration was seen. High myopia around 35%. In lattice degeneration in 35% cases were seen. In moderate myopia, 15% cases were seen. Macular holes were observed in 7% cases of high myopia. Correlation between PVD and axial length. Mean axial length in PVD patients was seen to be 26.7 mm. Mean axial length in non-PVD patients was found to be 25.2 mm. Statistical significance P less than 0.05 mm, less than 0.05. Coming on to the discussion, the study shows a high prevalence of PVD in myopic patients, particularly those with high myopia. Degenerative retinal changes were also more common in these patients. Axial length and age. Axial length and age are significant risk factors for PVD. Regular eye exams and OCT are significant for early detection and management of PVD and associated conditions. OCT has proven to be an essential tool for diagnosing PVD and detecting subtle degenerative changes in the retina that may not be visible on standard examination. OCT can provide high-resolution images of the vitreoretinal interface, allowing for the detection of partial or complete PVD, epiretinal membranes, and other early-stage abnormalities. Conclusion. Proactive management. Patients with high myopia should be counseled on the importance of regular follow-ups, even in the absence of symptoms, due to the asymptomatic nature of early-stage PVD. Proactive management, including the use of OCT, can help prevent complications and maintain visual health in the long term. Thank you.
Yes, very good presentation. But you have not grouped patient into ages. Do you think that the patient or 20-year-old patient will have retinal detachment because of PVD?
So, no,
Because
sir.
myopic changes of a 20-year-old boy and a 60-year or a 50-year man, when PVD will be different.
Yes.
So you have started from 20 years to 60 year, you know.
Yes,
So
sir.
it is all progressive. The degenerative changes are progressive according to the age. A young boy will not have PVD, or he will have.
Sir, sir, in older ages, PVD.
How many
will-
cases? What is the percentage of PVD in young age?
Sir, less common in younger age group. Rare in younger
If in a
age group.
patient complete PVD has occurred and there is a hole, do you think round hole, flat hole? Do you think it will cause detachment? Peripheral hole, round hole, flat hole, no fluid, and there is complete PVD.
Yes.
You are trying to correlate between the macular myopic complications with PVD or a cross-sectional study, isn't it?
Yes, sir.
Okay, thank you. Any other question from